Hello, I'm Dr. Foojan Zeine, and welcome to Inner Voice Show. On this episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them and supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi, I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, the psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples and how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with a package. So somehow we have to really, really work with it. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers, is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my clients would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Zeine, and welcome to the Inner Voice Show, the show that's about you and everything that matters in your life from a psychological perspective. In this show, I usually talk to the expert in the field of psychology, mental health, and life. And today, I'm very excited to have Bob Moylan, who's a licensed clinical professional counselor with me. Let me tell you a little bit about him. He's an author of 4 books. So let me tell you a little bit about Bob before I actually ask him to be with us. He graduated from Northwestern University in Evanston, Illinois, with an economics degree and a teaching degree. He received his graduate counseling certification from Loyola University in Chicago. He has taught grades kindergarten through 12th grade, including social studies and special education, and this includes learning disabilities, behavior disorders, and cognitively delayed students. He has served as a counselor in Cook, DuPage, and Kane counties, and he's been a lead presenter and a guest lecturer for counselors and career specialists all over the world. Now, I want to tell you about him in this way too. He is also a former Chicago Park District boxing champion, a Big Ten wrestler, and a letter winner for Northwestern University, as well as a high school tennis player, coach, and an avid golfer. So he's got it all, from the physical strength to the mental and psychological strength. He specializes in all types of mental health issues, including depression, stress, anxiety, fatigue, and a wide spectrum of others. Now, welcome, Bob. Thank you so much for accepting my invitation to come to my show, and tell me about your new model, the core therapy, that you have written 4 books.
Okay. Thank you so much for having me on here, Dr. Zeine. And again, it's a pleasure to be here, and it's a privilege to be here to serve your audience and the people in the United States and across the world, because mental health is it's an issue that all of us face at one time or another. We all suffer stress, and stress can weaken us. My background is I had years and years of stress, anxiety, depression as a kid. I grew up one of 13 kids on the west side of Chicago. My father passed away at 13 years old in a tragic fire, so I grew up pretty much on my own, left home at 14 years old. And I'm now 54 years old in a couple weeks. So I've had 40 years to really work through my own issues as far as mental health. For me, my emotional core therapy is really what I've developed as the simplest, most effective, and most inclusive psychology approach available worldwide. What I've done is I have discovered the root cause of stress, which is basically the arousal of the 4 true emotions: joy, grief, fear, relief. And I hope we can check out my 8-step flowchart here so you can see this. But
yeah, we'll do it. We'll do it step at a time. Bob, sure. I want to go first step at a time, because there's a huge claim. Everything that I've read from you and looked at, even your book and in the websites, there is this claim, like you said, is the only one in the world. And so that brings a question for me, because obviously I created my own model. There's a lot of models out there that everyone claims that they do a lot of work. But I wanted to know what it was about yours. And I know that it's personal because you created it the same way when I created my model. It was personal to me. And it works for you. But why do you claim that is the one and only in the world? Tell me about it.
Well, here's what it is. It depicts the natural state of how stress occurs. There's a cause and effect relationship with stress. And all the other approaches out there, CBT, DBT, REBT, schema therapy, etc., even smart recovery educational programs, 12 steps, etc., they try to explain this in a model form, a method. What happens is, because I discovered the root cause of stress, what I've done now is anybody suffering any type of psychic stress, whether it's marital therapy, divorce, job loss, parenting issues, financial loss, etc., all they have to do is plug their stress into my model and they can get back to a peaceful state. Think of it this way. You're entering data into a computer over and over again, and out comes a peaceful state of being. That's all you have to do with my approach. There's never been a situation I can't think of. I've had this approach thousands and thousands of times, and it's never failed. It's basically, that's what we call in science. All these other approaches out there, the only evidence they have is circumstantial or anecdotal. They don't have direct proof, direct evidence. My approach has worked every time, and anybody can test it, sort of like the Four Truths of Buddhism. Anybody can test my model at any time and show that it works. The 8 steps happen basically no matter, the aspects of the 8 steps happen in any stressful event. And I go back once again, whether you're suffering, say for example, you list in your life, Dr. Zeine, 30 stressful events you've happened in your life. Say when you're 10, you skin your knees. When you're 2 years old, you had diaper rash. When you're 5 years old, you were late running to school. When you're 10 years old, you kissed your first boy. When you're 15 years old, you went off to high school and were crying, missing a boyfriend, etc. When you're 40, you're stressed out, your first divorce or job loss, etc. All those events, all you have to do is plug them into my model, and you can see the 8 aspects there. That's why it's a really, I consider it the most amazing discovery one of the most amazing discoveries in the history of psychology, because billions of people suffer stress. Now they have a model that works every time. Mm-hmm. And the key is, the key for people is to get them to a peaceful state of being. And once you do that, whenever you feel the bodily stress of the 4 emotions, you go right to the flowchart, identify, process them, and release them, and you get back to a peaceful state. That's what these other approaches are trying to do anyways, but they really can't do it because they don't address the root cause of stress, which is the temporary arousal of the 4 true authentic feelings: joy, grief, fear, relief. Which are, by the way, with it.
Why do you think, Bob, that those 4 emotions are the key and the core emotions that every human being has? You've brought it into 4. How come you chose those 4, which are joy, grief, fear, and relief?
Sure, Dr. Zeine. When you go towards something you like, there's joy, okay?
Yes.
And when you leave that instance, like say you go towards an ice cream cone, or kissing your dog, seeing your daughter, or seeing a loved one, that's joy. And when you leave that situation, like leave an ice cream cone, or leave your daughter, leave a loved one, that's grief. And so the 4 true emotions come from entering and leaving relationships. When you go towards something you don't like, there's fear. And when you leave that, there's relief. Now, what happens is people have different names for these emotions. That's one of the real things that we work on in therapy. So for joy, happiness and related are just other words for joy, which is entering a relationship you like. Now, grief, sadness, depression are other words for grief. For fear, anxiety, dread are other words for fear. And relief is pretty much basic. Most people say relief or sigh, something like that.
So what I get from you is, this is what I'm hearing from you, is a lot of, as we look at children and as we look at human being, we look at pleasure and pain. And that either people go toward pleasure or they're kind of like running from pain. And what I sense from the 4 that you've explained is, if you're going toward pleasure, you're going to have joy. When you no longer have joy or no longer have the pleasure, then you have grief, which is also the sadness. And then the other one is, either you go through the pain and the fear and you experience it, or you don't and there's a relief. Is that what I'm hearing from you?
Right, and it could be one of the 4, and in some situations it's all 4. But what happens is it's just usually one at a time. What happens is, the real key is this, is the grief and fear, no one I ever met likes grief and fear.
No.
What happens is, I had just, when I was a kid, I had chronic anxiety from the age of 10 to 13 years old because my father was an alcoholic. I used to wear diapers until I was 12 years old. I had what's called PTSD for 3 years. And then I had bouts of depression even on when I was younger too. So for me, the worst thing in the world for me is to feel the bodily tension of grief and fear. I don't want it. And the key for anybody watching this show is this. Whenever there's stress, whenever they're feeling that uncomfortableness in their body and their head, nobody likes it, so people are learning to run away from it with drugs, alcohol, prescription drugs, etc. And those just change the perception, not your reality. The trick is to learn from these four true emotions so they're with us hourly and daily. Now, by the way, Dr. Zeine, these are just temporary emotions. The real predominant state of anybody that's learned my approach is one of a peaceful, relaxed state of being where your central nervous system is calm. The best approach I can think of is something like mindfulness, but what I do is I have a spiritual book now, so I incorporate prayer into my approach. Different religions can use prayer. As long as you don't use a lot of cognition, as long as you let your mind wander, daydream, you slow your central nervous system down, you can really stay, that's your predominant state of being. And most people just don't do it sitting and doing mindfulness all day. You could do this, gardening, you can do this doing yoga. If you go on to wiki.com, there's about 10 or 15 different approaches that really work, even pet therapy. They've tested different approaches like mindfulness, and they've shown your central nervous system is calm. What happens is when you have a calm central nervous system, and that's kind of your predominant state of being, where you're not using a lot of cognition, that's the whole trick, okay? When you don't use a lot of cognition, if you start to use cognition, Dr. Zeine, what happens is you start to inevitably think about relationships, coming and leaving them. That causes stress. The whole trick of my approach is to let your mind wander and daydream and have a relaxed state of being. The four emotions are just temporary anyways, and they cause us bodily stress. Even excitement, even too much. You ever see a kid, playing with his friends, eating too much sugar? They get excited. That's a temporary emotion. The trick is to cathartically release these emotions. I call it catharsis king. Just recently, I heard a song on the radio. I love it. It's Sarah Bareilles' song, "Brave." I want you to be brave. It talks about not holding emotions in versus letting them out. So catharsis is king, and I use a technique basically like Gestalt therapy, where I ask my clients if I could press on their hand. I press on their hand and I push, and then they push. I ask them to push back. What happens is the four emotions that usually come upon us hourly and daily, what happens is they cause us bodily stress. We have to learn to cathartically release those daily. It's sort of like brushing your teeth. This has to be normal for humans, and it's a necessary part of life. You're cleansing your soul hourly and daily. It's a form of self-care, and we really all need to do this. It's a vital part of my approach, which you'll see.
So,
and by the way, and go back to again the approach is irrefutable, because what happens is anybody can test the model themselves. It's right out there for you, but all you have to do is list some stressful events that happened to you now, 2 years ago, 4 years ago. Make a list of 20 things that are stressful for you. All those stressful events in life, even throwing out your back, shooting a basketball. I have a book on golf psychology, missing a golf shot out of the sand bunker. It all goes back to the 8 aspects of the flowchart that happened. And what you do is, over time, you learn those. And later on during the show, I'll repeat the whole steps, 8 steps, in a matter of like 10 seconds, But what happens is, usually when I do my training, I do CU training throughout the country, and in Illinois, I'm licensed to train 20 different professions, psychologists, social workers, counselors, nurses on this approach. I usually take about 6 hours to learn this. They watch my 1 hour training video, which is online, the emotional core therapy training video. The books I use are very interactive, so they have you do some writing exercises, some testing, some listing, so you can work the process yourself.
Hold on.
Again,
let me see if we can have actually the flow charts out. If we have it, I'm going to ask the director to put the flow chart up so we can go. Okay, so what we have right now here, it says relationship, and it says self, other people, places, and things. So as you talk about, you says the 8th process is relationships, and then needs, and then 5 senses, and then 4 authentic feelings, and then the effects and uncomfortable symptoms, and releasing process, and balancing your equilibrium, which is practicing various daily meditative techniques. So as you look at the beginning of the flow chart, I'm assuming that you're stating that there's actually a problem, an issue that happens in one of our relationships. So first you look at which relationship I'm having the issue in. Is that what I'm hearing from you?
Not exactly. Let me
then say it, please.
Sure. Relationships come together or grow apart. That's what causes us stress. So if I run into a wall, I'm running towards it, to something that's finite. That's still a relationship I'm entering into. But the relationships come together or grow apart. That's what causes us stress. That's what causes us stress. So this could be, like, say I'm here peaceful right here with you. What if I go out shoveling snow outside, I throw out my back? What if I go walk down the street and I find a $100 bill? That's another relationship. What if I go out and meet my daughter and go for, ice cream? That's another relationship. So what happens is relationships come together. We're always entering and leaving relationships. That's what we do as human beings. But the trick is, when you have a relaxed state of being, to examine each relationship and examine the next step is the needs of relationships. The needs of relationships are what causes stress. So, for example, I break these down into 4: emotional, financial, spiritual, physical. Now, if I run into that wall I was telling you about a second ago, the needs of the wall are physical, okay? And that's what's going to cause me stress. Hit my head against that wall, it's going to hurt. Now, let's take throwing a basketball. That's basically another physical thing too. The ball is physical, but so the needs are just basically physical that are going to cause me stress, and I have to think about. But let's take a look at a loving partner, your wife at home. She asks you to do the dishes, maybe pay the grocery bills, a couple different relationship stress. She's talking to you about her family members, and she wants to kiss goodnight, to go out the door. She wants you to pray with her at nighttime. All 4 of their needs are going to cause you stress: emotional, financial, spiritual, physical. So anybody in a real relationship, and in my book I have a chapter on couples therapy, so you can work on that. We're meeting the needs of other people, and they're meeting the needs of us. That generally is what causes us stress. So we have to learn to be in tune with other people's needs. That's part of the approach. So again, relationships come together and grow apart, but it's the needs of relationships. Sometimes emotional, sometimes financial, sometimes spiritual, sometimes physical. You isolate these variables and you examine, what happens is you perceive these. The third step is through your 5 senses. Sometimes seeing, like I'm doing a video with you right now. I'm not in person with you, so I can't touch you. I can see you through the video, and I can hear you on the microphone. I can't smell you at all, but I use the seeing, touching, smelling, tasting, hearing are the 5 senses. So what happens is, we use the different senses to understand these needs that are coming towards us. Now, here's the whole trick. The 5 senses basically dictate what we then perceive the 4 emotions: joy, grief, fear, relief, because we're entering and leaving relationships. So, for example, if I run into that wall, that's not going to bring me a lot of joy. That's going to bring me which emotion? Grief. And so, next time, once I have that grief, I'm not going to run into the wall again. You see, that's how it works. Say if I throw in a basketball and I miss the rim completely, it's terrible. That's grief. Well, guess what? I'm going to change my relationship with the ball. I'm going to try a different way to throw the ball to make a better relationship. So what happens is, the more we can learn and be in tune with our 4 true emotions, we can then change the relationships we're in to work towards more joyful relationships and leave relationships that are grieful and fearful. I'll give you an example here, because I like to joke around and make things small so you can learn from them. Let's take golf. They do a lot of golf psychology. I have a lot of friends that are golfers. A lot of us guys are stressed out. They're on the course. They're angry, upset, this and that. They're sad. They're fearful. And so what happens is, when you can learn from the emotions, your shots, when you miss a shot, if you can learn from that emotion and try something different, then you're going to be a better golfer. You work towards more joyful shots, get rid of more griefful and fearful shots. It's really the same thing with relationships. Go ahead.
Well, it seems like we're looking at the relationship, and I'm saying it another way so I can understand and the audience can understand, because every one of us have, as we've created a theory, we have it all in our head. But as we're expressing it, and you're teaching it, I just want to make sure that we understand it and the audience understands it. So what I hear from you is that the relationship creates stress. So all day, if I am in a relationship with whether it's an object or a human being or an issue, where in that relationship, either I am joyful and creating and moving forward, and in that moving forward, I experience either relief or joy, or I'm moving away from it, or it's being taken away from me, so then I feel like fear and grief about it, and through that creates stress for me. And then as I go along, I look at assessing, where is that? Is it in my physical body? What type of a stress is it? And where is it that I can do? And then you talked about the senses, the 5 senses. The third one is the 5 senses. So I get data from it. I can look at what type of data I'm getting from the 5 senses, and that is also creating, like, what am I hearing? What am I tasting? What am I seeing? And that creates my emotions. And then I can also assess the emotion and name it. And it's going to be one of these 4. And after naming these emotions, knowing what they are, then we go into identifying and releasing it. Is that what I'm hearing?
Perfect. And by the way, let me say quickly for the audience, because this is very a simple process, and I'll show you, demonstrate at the end. We basically sense these things automatically. Our 5 senses are basically so quick and automatic I hardly even think about it. The same as our central nervous system. When these emotions, the 4 true emotions, go to the 5th step is through our central nervous system, it happens automatically. So really the 3rd step and the 5th step, we really happen, whether you like it or not, we really don't even think about it. They just happen. I just put them in there because it's part of the process. The real crux of my whole approach is learning 6 steps. The first step, the second step, fourth step, 6th, 7th, and 8th. Now, so what happens is, again, we have the 4 emotions, as you mentioned just a second ago, those 4 emotions then go to our central nervous system, our brain, and throughout our muscles, tendons, our bodily stress, and they cause us bodily stress. Now, what happens is the 4 true emotions, grief and fear, are straight from the Diagnostic Statistical Manual. Basically, they're covered in there completely. It's very known throughout last 30, 40, 50 years that debilitating symptoms of anxiety and depression, which is basically fear and grief, they really can harmfully affect the body. I've had just last 8 months ago, one of my clients, a woman, her husband passed away after 25 years. The bodily stress that she'll have will likely happen for a couple of years. The trick is to have a supportive environment in place for her to release that stress. It just doesn't come every day, and you have to let it come at its own pace. Now, an empathetic, caring approach like emotional core therapy. In emotional core therapy, we use kindness, compassion, support. Anger and fear are not part of the approach. I'm big on, the old Rogerian approaches, kindness, supportive environments, not intrusive. My approach is, I'm a true spiritual healer. I really never tell people what to do unless they're a danger to themselves or others. All I say is, okay, you're making this choice. What's it bringing you? That gives the power to the client to make decisions. I never seduce my clients and say, okay, you have to do this approach, or this is going to be terrible for you, don't do that. I let them make the decisions because that gives them power and they learn from it. That's the whole beauty of it. For example, Dr. Zeine, it makes me sad, deep down. When I listen to clients during the day, say a client's smoking marijuana, maybe he's driving occasionally, or maybe he's yelling at his wife, maybe he's not watching his kids. These are all events that are sad. But therapists can't tell your clients what to do. That takes away their power. It's not healthy, it's intrusive, and we don't have the power as therapists. As a human being, we can't predict the future. I can never predict the future for any one of my clients, whoever they are, even myself, Right, so I can't say, go ahead.
There's a part that I'm sensing here that I'm missing from hearing it, that I get that we analyze it and we look at it where it's coming from, and then there's also the emotions, and then there's a release of emotions. There's a part of cognition that you're saying you don't necessarily focus on. Now, there's each emotion kind of gets created also based on some form of a thought process. I mean, whether we're going forward or getting close to a relationship or letting go, or it's about getting together and not having that relationship, these are all some parts of the thought process and the cognition that comes with it. Are you also adding that concept of cognition within the emotion? Because through the 8th process, I'm not hearing necessarily that anybody's looking at it or not. The only thing I'm hearing is, I'm asking if that's the approach, as what I hear from you is when you recognize the emotion, the part of the releasing is more of just kind of being with the emotion, feeling it, expressing it, and allowing that emotion just kind of like to take you wherever it is so that it can release and you can calm your body. And hoping that as you're doing that the issue that is upsetting you, it also gets released or resolved and brings you into an equilibrium. Is that what I'm hearing?
Let me make this clear. Let me give you an example. Let me tell us a case while giving the answer, so it's easier for the audience and yourself to learn. I had a couple clients that went through boot camp. One went through boot camp, was yelled at by the sergeant, suffered PTSD symptoms, was stressed out, he wasn't eating, wasn't sleeping, having nightmares, etc. Another person went through the same boot camp and didn't have any issues. He enjoyed the camp and felt it challenging. 2 people, same environment, different perceptions. We can't, as therapists, we can only take in and examine what clients are telling us. So they're telling us they have these emotions, fear, whatever, and it's up to the client to figure out what they want to do, to choose to keep in that relationship or leave it. The trick with the 4 emotions, Dr. Zeine, is they go in varying degrees. Now you can have a small little, for example, let's take snakes, okay? I hate snakes, by the way, okay? But if a snake is 100 yards away from me, I'm not going to be scared because I can run away from it, I can get in my car, I'm not even worried at all. But if I'm 2 feet from that snake, I'm going to be very worried. Now, get this, if I'm 1 inch from that snake for 3 hours at a time, I'm going to have close to chronic stress. If I'm in a same cage with a snake or 10 snakes for 3 days, I'm going to have longer term stress. In other words, everybody's different to the levels of fear that they have and the levels of grief. Now, here's the whole trick with emotional core therapy. These feelings are debilitating for people. That's what really a lot of weight on your body is, drugs, etc. People get into these situations, or basically a bad job. You talk to anybody over 40, they probably had 1 or 2 bad jobs, or a legal battle, or divorce, or a loved one getting sick, etc. People get into these, invariably what I see is, people get into long-term stressful situations they cannot get out of right away. It might be a year or two, and I discuss these in my books, and that's why people have situational long-term stress. And we have to watch this closely, and as therapists, that's why they come to us. I've never met anybody, Dr. Zeine, that's come into my office and paid me because they're too happy. Never, okay? It's always because they're too stressed. And what I mean by stress, they have too much grief or too much fear, or a combination of both in their lives.
But Jim, the question is still is for me, as you're talking, is the fear or the grief comes usually because there is an issue that we are perceiving and we're making it into some negative concept, or we're making that type of a meaning. So as we are sitting, you're saying we're going to release the stress, and I'm asking how? How are we going to stress? How are we going to release the stress? By what? How do you even handle an issue of life? Because life is full of issues in the relationship. So how do you even do that in resolving it if you're not at all dealing with the cognition, and it's just, okay, I got fear, I got joy, I got relief, now I want to release it. Okay, now you can release it, and you said you can utilize many of the different meditative techniques in order to release it. The piece that it's missing for me, and I'm still not hearing it, so I want to really hear it, because most of the world has past 100 years kind of worked with the cognition also. I do get that I don't see it in your model, so I just wanted to know, how do you handle the cognition? You ignore it completely? You don't deal with it at all? And if you don't deal with it, where do you assume that thinking is in the process? Because obviously every human being is thinking, and therefore they're feeling, or they're...
Sure.
Right? Okay, so tell me about that.
Well, that's beautiful. You make a great point. And I'll give you an example. I'll give this again. I'll teach you through an example. The 7 step in my process is the way is releasing emotions, and I give about 20, 30 examples in my book, Psychology Techniques to Release Your Emotions. The 8th step is meditative exercises. The trick is this, is whenever you feel stress, you're basically going through the flowchart, and you're identifying the stress, processing it, and releasing it. This happens all the time, and what happens is healthy people do this. They verbalize, they write down. For example, let's go to step 7, which is about my approach. Once you have these feelings of joy, grief, fear, relief, you're learning to learn from these emotions that are with us hourly and daily our whole life. So what we do is, one of the best ways to do it is verbalize your emotions in a healthy situation with your friends, family. And I'm going to list 15 for you right now. We can do art therapy. One of my favorites is music therapy. And it's, by the way, it's not me, it's what my clients like from their worldview. I ask them, how have you released emotions in the past when you're feeling good? You could do Gestalt therapy, role playing techniques, empty chair techniques, EMDR, Reiki, biofeedback, hypnosis. I saw those on your website. These are all great techniques to release emotions. The trick, Dr. Zeine, is portability and deliverability. What can you deliver to the client that he can use? Now, I'll give you an example. A boss screams and yells at his subordinate at work. She suffers bodily stress, and you see her once a week. Now, this goes on for 3 months. She only has 2 minutes to go to the bathroom or sneak out and get a coffee to release that stress. How can she use it? Well, we can't really do biofeedback or hypnosis right there, but what we can do is maybe do a little journaling, maybe verbalization, call on the phone, call some friends. Maybe we can do some music therapy, release emotions there. Maybe we can do some role playing with a friend or talk about it. Maybe we can do some meditative exercises, which can indeed release emotions. But I list about 20, 30 in my office. And real quick, just so you know, what I do in therapy is I do a couple of basic things as far as, again, gestures. All my clients really know over time, because it's sort of like Gestalt therapy, but I do a lot of movement stuff. So again, I press on my hands to my clients, and they push back. My clients all know over time, at their own pace, they learn emotional core therapy. Some learn it in a week, some learn it in a month or 6 months. We always take clients where they are. Some clients only learn at personal therapy. Some learn it all. We have to accept clients totally where they are and take them and accept them completely where they are, and that's what I do. But generally, people come to us because they're in pain. And so I ask them, are you in pain? You know, how would you like to do something about it? The beauty of my whole approach is they can do a lot of this on their own. My video is free. It's online on YouTube. I'm also a therapy training video. My book is $10. I even give out portions of my book for free in the local community. It's on my blog are the first 2 chapters of my book. What happens is, the trick is when people read, okay, it's very powerful and soothing to read. You can read the case studies. I have about 20 case studies in my book of situational stress that people have gone through in their lives. And in my video covers about 20 different examples too. So they can walk through the examples and learn from it. And that's the best way known to man. I actually got this from a great writer years ago. I saw, he wrote the techniques of group therapy out of Stanford, a professor. He had a couple books. The Gift of Therapy, the guy wrote. I can't remember the guy's name. He's out in California. But I learned how to write stories, case studies from him to make it soothing and real for the client. Now, let me give you an example, Dr. Zeine. For example, if I wanted to really teach emotional core therapy, you would have the clients go through stress. For example, run into a wall, lose $1,000, okay? Get thrown out of the house, you know, have the kids yell at you, etc. But you don't want to do that. Nobody wants that. It's crazy. Well, what the best thing to do is, you know, we can learn from past situations, or we can go through and read stories about it, and then we can practice it as we go forward. The trick is, anybody that's suffering stress, all they have to do is go through the 8 steps. Anytime you're suffering any stress you have in your life, it all goes through the 8 steps. So let's do this real quick for you. Give me a stressful event in your life real quick that you've had in the last, how about in the last couple of weeks, just name something that occurred to you as stressful real quick, or anything you want, any stressful event that maybe not you or one of your clients, or just make up something for.
I mean, what has been real is that I was supposed to interview you next week, and last night, very late, I had my guest, something happened, her child got sick, and she just was not able to be at my show today. And so obviously the last minute I'm stressed because I need to be able to deal, and obviously you were my stress releaser, so last minute I see you sending me a confirmation email to come to next week, and I'm like, yes, come today, can you come today? And you said yes. So obviously right at the beginning it's the highest level of stress because something that is happening that I'm responsible for, and you know, I don't have enough time, or you know, plenty of time to be able to do that and figure out what to do with the live show. So that's the stress.
Right. All right. Now watch this through the process here.
Okay.
So what happens is relationships come together or grow apart. In this relationship, what's really happened to you is the person's name. Let's give her a name of Pam. Okay. Pam had to depart making plans to come to your show. Her plan was to come to the show the next day. That was your perception. Right. Okay, so the relationships you thought you had was Pam coming to the show. Now that's not going to happen. So what happens is the relationship with Pam, her responsibility was to be here, basically emotionally talking on the show, and basically physically through the internet. Talking on the show. Those are 2 needs that the relationship was going to have. When she didn't show up, it brought you, if you sensed that, she called you on the phone, you sensed that through hearing her on the phone telling you that, okay? And it brought you one of the 4 true emotions. It brought you grief, okay? Now that grief went to your brain real quick. It brought you bodily tension. Maybe it was in your head. We don't know exactly, but you would tell me, yeah, I was sad for a little while in my chest. My head was a little tight. I had to think, release about it, talk about it. Maybe you went to the bathroom, got something to drink. Maybe you yelled a little bit. Maybe you just verbalized it. But when you released it, you get back to a peaceful state, you realize that relationship is gone. There's nothing I can do with that relationship. It's gone, okay? Now, that would bring you a great sense of grief because you wouldn't have any show at all. So what did you have to do? You had the next thing you do is enter into new relationships. Either call me or call someone else, cancel the show. A lot of factors could come into play which cause you bodily stress. Fortunately, you sent me an email and I responded to it. So what happens is you entered into a new relationship. The new relationship is with Bob Moylan, here, me, and this new relationship, I basically, your needs are to have Bob, using your camera, talking to you on the phone. That's basically a physical. We see it, and emotional, we're talking, hearing. You sense that now through your senses. Basically, what you're hearing again, you're seeing me on the video and you're hearing me, and hopefully it's bringing you joy. My goal is to bring you joy and bring the audience joy. Now, if I was horrible, terrible, my ideas were all poor, I would bring you again a sense of grief. But hopefully for the audience, and I'm very conscientious of all my clients here. Anybody can call me up after the show. My contact information on their website. I'll be glad to come back, explain any process. I'm really a public servant, and I'm glad to help people out. So for anybody in this audience, I have compassion for you, Dr. Zeine. This happens to you right away. If I could do anything in the future to help this happen again, I would be glad to do that. I'd be a standby. You can always call me, that type of thing. But again, what happens is now, I'm bringing you joy. You're learning something. The audience is learning something. That goes to your central nervous system. You have a little bit of euphoria, a little bit of excitement in your body. You're like, oh, this is going good. I'm happy. And so you have to, even excitement, we don't want too much of it because it's going to leave us eventually. But what happens is you have that joy. You may talk to your person at home, your producer, and say, hey, that worked out pretty good. I'm excited for this. This is the audience like this. I'm happy. You talk it out. You may write a couple notes to people saying, hey, this was fun. And then you release it and get back to your own state of being, your peacefulness, your centered state of being. And so all we can do, Dr. Zeine, is learn from each situation. I think one of the best things I do when clients don't show up or don't pay is I have a policy in place in the future is that they could call us within 48 hours before cancellation, and maybe you can always have a standby backup, like Johnny Carson always had a couple guys that he would show on his show, so maybe I could be your fall guy. If I did a good job with the people here, I'd be honored to be your fall guy for future events in case people cancel.
So as you're doing the example, I'm hearing that the cognition work is happening within it, although you're focusing more on the emotional aspect of it and releasing the emotion. What I hear is that when you realize the emotion, the for emotion, and you kind of like let it be and you're letting it go, that the hope is that the cognition process, the rational thinking, when the body is not stressed through 4 of these emotions, and basically 2 of the emotions bring stress, when the body is not going through that our system is in power where it does its own rationalization and takes care of it, like it does. As you were going through the experience with me, my system will go through the reality check, will go to see what it is that needs to be done. It's just that when the body and the physics and the psyche is in stress, it holds the process of rationalization and doing things. So I'm supposing that you're pretty much focusing on the obstacle. So if it's stressed physically and psychologically and emotionally, the issue of stress is either 4 of those, which basically 2 of those, which is grief and fear, will bring up stress. And
all 4, Doctor, all 4.
All 4 of them will bring stress for you. And then when you notice those 4 and allow it to be, release them, and the rationalization part and reality check will automatically come in because those are skills that we already have and creates it. So because of time, so tell me the last thing that you want our audience to know about emotional core therapy.
Okay, let's go to the final step, because the final step is the closest thing I can give an example of is mindfulness. We learn to have a peaceful, centered state of being in the here and now. We pay attention to our breathing, relax. The trick is to have a calm central nervous system. But most people don't still do mindfulness during the day. It's not practical. It's also not where most clients really are. My approach really takes people where they are. Some people relax with prayer. I would say 60% of my clients pray during the day, whether it's Islamic, Hinduism, Christian, etc. They're praying, and they use prayer. They incorporate prayer. And so they can do that. As long as they're not doing a lot of cognition, they can have nice images of their religious figures. They can even have a higher power. But you can even do this doing yoga, even Pilates. As long as you have a relaxed sense of being. We do, Dr. Zeine, that's a good point you make. We do meditate and relax during different ways. Like, for example, yesterday, I went out and did Chinese massage for 90 minutes. I actually do that every other day to stay centered and relaxed. I also do what's called red light therapy, where I sit for 30 minutes in a tanning booth. And I get deep heat. It's good for my golf injuries that I use, but it's also good for skin moisture in your skin. It's also good for acne. It's good for your keeping seasonal affective disorder out here in the Midwest. But there's a lot of people relax and meditate in different ways. So my approach is very flexible, very client-centered. But here's what I would like to tell the audience. Feel free to examine my video online, the emotional core therapy training video, because it's free. I walk through about 20 different cases I've used of people suffering stress and how I walk through the 8 steps, which we're trying to do here. Not only that, my books are, you can see part of the first 3 chapters of my books are on my blog, so you can read them for free. I also have a course description of all my courses. I train people throughout the country, and so I basically, all my course descriptions and etc. information are all on my blog, which is Moylan, LCPCblogspot.com. That's all on my website, emotionalcoretherapy.com. You can always call me, or maybe have forward information to Dr. Zeine. I'm an open book. I'm really, like I said, I like to help people. Now, here's the real thing, last thing, okay? All other psychology approaches out there, whether it's CBT, REBT, DBT, they teach you to redirect your emotions from your true emotions. The true emotions are what cause us bodily stress. That's unequivocal and undeniable. You can't, it's irrefutable. So what happens is, anybody suffering stress, I try to get them, when they're suffering big time stress, they've lost $100,000 in a stock market, and they go, oh, Bob, I'm stressed. I get them back to a peaceful state of being. Maybe when they're in college, maybe 10 years ago, 5 years ago, I have them take pictures of themselves. Show pictures of yourself when you're peaceful, remembering this is a temporary time for you. They're not suffering. This is not a permanent situation for you. These are temporary. My first master's was in history, by the way, so I always do a complete detailed history for people, find out when they're peaceful and happy. This may have been, 5 or 10 years ago, but we want to get people to realize that they can have a peaceful state of being, And remember, the real thing is, Dr. Zeine, to be kind and compassionate to people when they come in. We're all a little bit walking wounded from time to time. We all come at different stages when people come into therapy. So when I start therapy, some clients might be needing help for a couple months on meditation exercises. Some might need help for a month or 2 on releasing exercises, which I see you're big on.
Wonderful.
Your website. Some might need help on just examining what relationships they can and can't handle.
Right.
A lot of people need help on the 4 true emotions. But again, the whole trick is to learn from these emotions rather than running away from them.
Wonderful, yeah.
That's real powerful. Yeah.
We need to close. So thank you so much for explaining the emotional core therapy. And I'm sure that for all of you who really want to let go of those emotions and let go of stress in your body and want to come back into a peaceful place in your body, you can go ahead and go to Robert Moylan's website and read his book, Emotional Core Therapy, and learn how to be with yourself and your body. Thank you so much, Mr. Moylan. Thank you so much for being on my show. And for all of you who have been with us, thank you for being with us. And until next week, have and create a wonderful world for yourself. Goodbye.